Good morning, everyone. My name is Gail Strack. I'm the CEO and co-founder of the Family Justice Center Alliance. We have renamed ourselves to Alliance for Hope International. I'm excited to know that we have about 400 professionals registered for this webinar this morning, and I'm told that it is rising. So, welcome to the webinar. A couple of things that you need to know is to make sure that you are on mute. And then also that we will be downloading this particular webinar. Just give us about 24 hours so you can have full access to it. We always like to start with our mighty, and I call amazing team. Here at the Alliance, we are led by Casey Gwynn, who is our amazing leader. Has been our local leader, national leader, and international. Today I get to host the webinar. We also have Natalia, who is right here doing the heavy lifting for the webinar and doing all the worrying for us. And then, of course, we have Chris as our finance director, Jennifer Anderson, who has been with us for many years and runs our California initiative, Ruth Stanson, who has been helping us with strangulation, and we just recently stole Michael Burke from Shasta Family Justice Center, and he has joined our team. So this is our team that we work with. We like to let everyone on this call know who they are. So if you do need to reach out to them, you can put the name, face, and email all together. We also like to start off our webinars by thanking our sponsors, the funders who make our dreams come true. We're especially grateful for the Office on the Violence Against Women and Blue Shield of California Foundation. So thank you so much for making this training available. And we know that all of you make good use of it because nobody needs to leave their office, fight for parking, or go to an airport. Most recently, Casey Gwynn just wrote an amazing book called Cheering for the Children. I read it probably about 5 times through the editing process and after. It is definitely a must. I wish we all would have had this book 15, 20 years ago to be able to really understand ACEs and also to connect the dots of what programs and prevention and intervention models do we need to have to help our children when they're experiencing domestic violence firsthand, experiencing child abuse, or witnessing it. So the webinar download reminder, we talk about this twice for a reason because it's a frequently asked question. Again, please give us 24 to 48 hours to download everything. It is accessible to you for free so you can share it with your friends. And now, this is the reason why I woke up, I actually jumped out of bed today because I was excited that we were going to have this webinar. Not only is the issue elder abuse important to everyone, especially at family justice centers, but we have quite a gift today. We have Dr. Dean Hawley and Candace Heisler. I'll give you a brief bio about them because I want them to just jump in and share their amazing experience. I'll first talk about Candace Heisler. Candace is not only a friend, she has been a mentor, and how I met Candace was through the California District Attorneys Association, and she has previously spent a good chunk of her career as a prosecutor at the San Francisco District Attorney's Office, and she headed their domestic violence unit, charging misdemeanor, and she was responsible for all the training that we had at the California District Attorney's Office. And one day I met her, and I go, oh my gosh, I want to be her when I grow up, because she was just so amazing and she was just so kind when I would ask so many silly questions, especially in the area of elder abuse. So she helped me understand what I didn't know. Since then, she has continued to go on and provide training and consulting. She has written curriculum for not only judges but for many professionals. She's also won many awards for the work that she has done, and currently spends most of her time teaching and consulting and helping the Alliance as part of our faculty, not only on webinars and our annual conference and elsewhere. We also have Dr. Dean Hawley, another great friend and mentor. We met sort of in a blind date. Candace Mosley set us up to talk about strangulation, and ever since then, we've been very close friends. And this is probably one of the smartest men I know in this world because he just knows like everything about everything. Dr. Dean Hawley is a forensic pathologist. He's a tenured professor of pathology at the Indiana University School of Medicine. He is board certified. He's probably testified in more cases in the last 25 years than any single individual. He has truly helped us understand strangulation, and it's just amazing the heart and the mind that he has, because he has taken everything he has learned from people who have died as a result of domestic violence, elder abuse, sexual assault, or the strangulation, and then it's helped us try to prevent those homicides from happening. He, too, spends a lot of time in the research. His interest and passion is in family violence. He has written a lot of peer-reviewed medical papers and helped us with our manuals as well. So I'm going to turn this over immediately now to two of the leading experts in elder abuse to really frame the discussion about what does that look like at a family justice center. So Candy and Dean, take it away.
So for Gail and Natalia, the folks at the Alliance for Help, Candace and I offer our thanks for the U.S. Department of Justice Office on Violence Against Women and the folks at Anthem Blue Shield in California. Thanks to them for making this possible. My name is Dean Hawley. I'm a forensic pathologist. I'm in my office at the Indiana University School of Medicine in Indianapolis. Candace Heisler is joining us also from her office at Heisler & Associates in San Bruno, California. The topic today, working with elder abuse clients, relates to the way that family justice centers and other folks wanting to be or aspiring to be family justice centers can begin to frame the context, depth, and scope of the problem of elder abuse and neglect as it relates to other work that we all do with violence against women, particularly across the United States. Natalia, the first case that I selected on the next slide is an Indiana example of a man who has abused his grandmother by confining her in her own home and using an electric stun gun to shock her hundreds of times in an effort to abuse, torment, and to get money out of her. This case is an example of what we occasionally see as isolated, explosive incidents in family violence that oftentimes, more often than not, have considerable background history like domestic violence. And it is the main theme that runs for me through elder abuse, that these cases are really rarely explosive, individual, singular events, but they're much more likely to have a history and a background that is deeply intertwined with domestic violence, sexual abuse, elder financial exploitation, domestic violence in late life, and neglect. Natalia, on the next slide are the topics we're going to cover: how to recognize elder abuse, what to do when you do recognize or suspect elder abuse in terms of our common liabilities for duties of reporting and ethical considerations regarding confidentiality for when we must report suspicions of elder abuse and neglect. And then finally, a discussion about elder abuse clients, individual cases, what the special needs and considerations are for those of us who aspire to be service providers to abused and neglected elders. Candace, why don't you follow up with recognizing elder abuse and a discussion about the roadmap?
Thank you, Dean. Thank you, Natalia, and thank you, Gail. Good morning or afternoon to everyone who has joined us. I think it's fair to say that Dean and I are both absolutely delighted with the interest that's been shown in our topic. and looking forward to hearing afterwards how this may be helpful to those of you in FJCs. We're going to start by giving you a brief overview of what are we talking about when we say elder abuse. And it really, next slide if you would please, it really isn't a statutory definition that I think helps us best understand, but it's really one that was developed by working with about 750 experts from a variety of fields related to elder abuse and trying to identify the themes, concepts, and experiences people in the field have had around what we call elder abuse. The project that developed this was overseen by the Department of Justice, and it has been since known as the Elder Justice Roadmap Project. But after the experts looked at these different ways of seeing things, talked about what were concepts and related concepts, and what were some of the unique aspects of interactions involving older adults, this definition emerged. Again, think of it as a framework. So elder abuse is a variety of forms of abuse, including physical, sexual, and emotional or psychological, as well as neglect, and here we're talking about neglect by a caregiver, abandonment, which in many cases is subsumed into definitions of neglect, and financial exploitation, the fastest rising reported form of elder abuse of an older person. Whatever older person means may be set by statute. There's quite a variety of approaches, but it involves another person or an entity. It can occur in any setting. So most elders live in their, in their homes and in the community. So it's not a surprise that the majority of reported elder abuse is in community settings. But there is a significant percentage of older adults, particularly the most frail of older adults, who are in long-term care settings. And so that relationship and that setting is also important. But what separates elder abuse from bad things that happen to older people is the context in which elder abuse occurs. And that is in a relationship in which there is at least a societal expectation of trust, and when we have an older adult who is targeted by a perpetrator based on their age or perceived age or disability or perceived disability. So it's not just anything that can happen to an older person that's negative. Please move the slide. It's worth thinking about some general concepts. Very infrequently does one form of elder abuse present. If you do a good investigation, if you are talking to people, if you're doing intakes of clients who are elderly, what you're going to find if you're careful and persistent is that forms of elder abuse co-occur in various groups and patterns. There is a term for this. It's now increasingly being called polyvictimization. It's also worth seeing how these forms work together because one may be used to facilitate another. So we may have what starts out as a physical abuse case, but the underlying goal of why the son is strangling his mother on a monthly basis is to get her to sign over her check. So it's a component of financial abuse. Experience has taught, always look for financial. It's almost inevitably there, although it may be subtle and it may be layered. It's also worth noting that psychological, also called emotional abuse, is usually present and occurs with other forms, almost without exception. If you could move us along, Natalia. Now, there are things which are particularly valuable for you folks in FJCs to think about. They may fit within our definition of elder abuse, but we're calling them related phenomena because they are things that may happen to elders, but they equally happen to people who are not elders. So abuse in later life, and this is going to look a great deal like domestic violence and sexual assault in later life committed by a variety of perpetrators I'll talk about momentarily. And abuse in later life is a term of art that has been adopted by the Department of Justice Office on Violence Against Women, and particularly in their later life grants program. And for those of you who are wondering what the age for elder is, you may need to buckle your seatbelts because the age has been set at 50 and older. And that was done primarily because when advocates looked at who was receiving domestic violence and sexual assault services, the programs typically were not serving people over 50. There were other services that were available to younger adults, such as TANF, and benefits programs that were not available to older persons. There were also older benefit programs that were not available to younger. So there was this identity of this is partly DV, it's partly elder abuse, so we call it a related phenomenon. Now, many states don't talk about older adults or elders, they talk about vulnerable adults, and we'll define a vulnerable adult as anyone 18 and over with some significant physical or cognitive disability that affects their ability to protect their rights or look after their basic needs. Clearly, some of those folks are elders and will fit under our definition, but for those who are 18 to 59 or 64, depending on your definition, those acts of abuse would not fit but are related. And then stranger crimes that the criminal justice system sees against persons 60 and older. So the burglar who breaks into the home of an older person, the person who does a street robbery, not particularly aware of the age of the perpetrator. Those are examples of related phenomena. And then finally, we do distinguish abuse or neglect that a person commits against themselves where there is no third-party perpetrator. It's a very frequent occurrence in elder abuse, especially when we look at what kind of cases are reported to Adult Protective Services. What I'd like the folks listening to take away from this is, while we don't typically think about self-neglect, we should at least explore whether it's occurring, because there is research to suggest that some self-neglect is an outcome of a prior victimization. And so you may see a client who has started the self-neglect because they no longer have their resources because of financial exploitation. It can't meet their medical needs, can't maintain their property, can't take care of their personal needs. Let's move along and talk a bit about who commits elder abuse. And if I were to draw a circle, or if we were to have a discussion about who does most elder abuse, it's not strangers, even though that is who typically older adults are most afraid of being victimized by. Most of the people who commit elder abuse are people who are known, trusted, and loved by victims who are elderly, and most often those people are spouses, adult children, and other family members. Let's move on and talk about why is it important to think about elder abuse. Elder abuse has been shown through very carefully peer-reviewed research to have terrible, terrible consequences. There are obvious things like financial suffering, even impoverishment, but it's also worth knowing all forms of elder abuse result in higher degrees or higher percentages of hospitalization, increased need for placement in a nursing facility, premature death. People who are victims of all forms of elder abuse die sooner than they should have. In addition, it exacts a terrible toll on families because the elder victim, who especially is financially abused loses trust in their ability to make their own decisions and trust their own judgment. Their children or family members will more often than not try to help by coming in and removing authority that the older person has previously exercised over their lives, and that will undermine existing trusted relationships within families, and family relationships are eroded and destroyed. Elder abuse exacts a terrible toll, and that's true whether we're talking about a physical abuse victim, an emotional abuse victim, a financial abuse victim, or any other. So Dean's going to talk briefly about sexual assault in later life, a really important component of abuse. So take it away, please.
Sexual abuse is the least commonly reported and the least commonly recognized form of elder maltreatment. In a very recent study done as telephone interviews of Americans living in their own home, where those people were enrolled in Medicare services and could be contacted, randomized and contacted randomly by the Centers for Disease Control, up to 0.9% of elder abuse can be accounted for as sexual abuse. That statistic is significantly higher than previous studies, and may be based on the fact that the study was better designed, or that the people conducting the phone interviews were more impartial to the questions that were being asked. Sexual abuse includes contact anytime a victim cannot give consent. So if an elder does not have the capacity, through loss of cognitive ability, to give consent, then any sexual contact is inappropriate. The abuser can be a family member, and as we just saw from Candace's statistics, the abuser usually is a family member. Of all the people on earth to fear, you should fear your children the most, and that remains true, and it gets worse the older we live. My 31-year-old daughter just moved back into our home. You should pray for me. She hopes to have a job and move on soon.
Hi, Dean. This is Gail. Thank you for making me laugh out loud. Natalia would like us for you to just speak up a little bit louder so our folks can hear you a little bit better. And Dean, you do have an interesting sense of humor, because when I told you the good news about my children graduating college, getting their jobs, moving out of the house, you were happy for me, but you were happy for me in a very different way. I remember you said to me, Gail, be thankful. You have just reduced substantially the likelihood of you becoming an elder abuse victim. So I guess the professionals in our world, we have an interesting sense of humor, but I think we also need to keep our sense of humor. So Dean, thank you for making me laugh out loud.
And Gail, I have changed my connection so that hopefully the audio is clearer and louder.
Thank you. It is. I can hear it. It's better already.
Oh, these computers. At my age, I need my children to help me with the computers, but at the same time, I'm afraid to have them in the room. For elders who are living in facilities, the abuse can be by staff members in facilities, and if that is occurring, those staff members are likely to be predators, repeat offenders, and serial offenders. The type of sexual contacts can be hands-off for individuals who, for example, exhibit themselves to elders, or simply engage in unwanted conversations in front of elders, or for individuals who, for example, put pornography on the television and then walk out of the room. There can be, of course, touching, hands-on practices, and the third category would be harmful genital practices. Of that, we refer to so-called medical procedures of washing, changing diapers, changing catheters, where there is not a necessity at that point in time to have genital contact, but the individual is choosing to do that for some kind of power and control dynamic with the victim, or because they're aware that the victim doesn't like it, and so they do it for that explicit purpose. Candace is now going to take us through domestic violence in later life and some of the other components of abuse in later life.
Thank you, Dean. I want to just make one more comment about who abusers of a sexual nature are in facilities. What we find is there can be a history of domestic violence where a spouse has been abusive, and now the victim spouse has moved into a facility because of care needs. And during visits, the perpetrator spouse continues the abuse of a sexual nature. It's not at all uncommon. We also see situations increasingly often, and this is one of the new horizons and new challenges in elder abuse, resident-on-resident abuse, where you will have two people, both residents of long-term care facilities, one of whom may be stronger and more able than others. Could be a younger psych patient. We're also starting to see sexual offenders who are being released from prison and paroled into skilled nursing facilities. Some of those facilities also serve elders. And so you are increasingly seeing attacks by residents on other residents, typically a stronger on a weaker. It is also part of organic-based violence. There are some perpetrators living in skilled nursing facilities who cannot control behavior because of physical or underlying medical problems, and they become sexually active, acting out, and will act out against other residents. So this is something to keep in mind. It is one of the new horizons or vistas of sexual elder abuse. I'm going to talk now a bit more about abuse in later life, and I do want to say that sexual abuse in later life is an element. It is part of that pattern of violence, physical and sexual violence that we have seen in younger families, in domestic violence. But abuse in later life is similar to domestic violence in that there are specific domestic violence power and control dynamics, but they look a little different. In addition, abuse in later life is not limited to intimate partners, but also includes abuse using power and control by other family members, and often that's an adult son abusing an older mother. But the older male victim abused by a son or daughter is not unheard of either. These cases do need to be distinguished from organic-based violence, which is violence or bad behavior that is the result of the inability to control behavior related to a disease process. So later forms of dementia, brain tumors, some parts of some stages of Parkinson's and also Huntington's can be examples of organic-based violence situations. Please note these are the exception, these are not the rule. And more often than not, these are going to be identified through the family telling you he's got a medical problem. There will be medical backup. There will be documentation that will support that. So we don't want to over-focus on organic-based violence. We just simply need to know that it can occur. Let's move along and let's talk about the dynamics of abuse in later life. For those of you who are used to, and everybody in this audience should be used to the power and control wheel, visually imagine the power and control wheel you work with on a more regular basis. So the wheel you're looking at on the screen was developed by older victims of abuse in later life, several hundred of them around the country. They were initially given the original wheel that was developed in Duluth, and they were asked to comment if their experience of abuse in later life, many of whom were abused by adult children, some of whom had mental health issues, Some were abused by spouses, others by trusted caregivers. And they asked them, does the Younger Life wheel describe your experience? And what they said is there are fundamental similarities. So these include the use of violence, both physical and sexual. Now the violence is intermittent, it's not every day, and it could have happened years earlier. But a person, as we all know, who has been the victim of this kind of violence never forgets the power another person holds over them. The goal the older victims readily recognized was power and control. But they said tactics were a little different. And so as you look at this and sort of mentally check off what are some of the differences, I want to highlight a couple. So looking at the life of an older person, and something neither of us has said, but it needs to be said at least now, is there is no single flavor of older adults. They are along a continuum very much the way younger adults are. Some are extremely independent and high functioning. Some are significantly unable to provide for their needs. And whether you're talking about younger or older, don't assume that most of your clients who are elderly are going to have dementia or are otherwise impaired physically or cognitively. We are used to seeing very much older adults performing at very high levels. And an example that I'm reminded of is when I look at the Supreme Court. There are judges who are functioning in their 70s, 80s, and 90s, and who no one would suggest are less than able to perform their duties. We have world leaders who would meet our definition of elders, similarly performing very well, and age is not a predictor of the ability to carry out independent and elaborate life functions. But going back to the wheel, the victims who did have vulnerabilities, they might require the adult son, for example, to assist them with getting out of bed so they could take care of bodily function needs, or who needed help preparing meals because of arthritis or other limitations, talked about how their abusive child would take advantage and target those vulnerabilities and choose when to meet the person's needs and when to neglect them, all as a way of maintaining power. Older adults as a group tend to be believers, observers of traditions, both spiritual, religious, and the like. And abusers, we heard again and again, would deny access to those important traditions and observances as a way of getting what the abuser wanted. As a way of berating people and undermining self-esteem, abusers would make fun of personal or cultural values that an older person hung on to and that really focused their lives and gave meaning to their lives, and would undermine them by making fun of them. But the biggest differences are not those. The biggest differences are these overarching hash marks of emotional and psychological abuse. And what the victim said that we should remember is, in late life, these, which in earlier life would have been called emotional abuse and would typically be the put downs, the you're less than, nobody would have you but me, those kinds of things continue, and those are what victims in later life call emotional abuse, so those are still there. But what has been added are attacks, targeted attacks on independence and belief in one's ability to make good decisions. So these are attacks on their function, on their brain function. It is suggesting that people have Alzheimer's, that they're forgetful, that they can't balance the checkbook anymore. And these are used so that the elder starts to give up control over critical parts of their lives. And once they have given up those parts of their lives, the abuser is much more able to financially exploit them and is much more able to control every aspect of their lives. There is one other thing to say about the wheel, and that is there is a missing segment from our younger wheel. And rather than have you all mentally try to figure out what's missing, for those of you who haven't recognized it, it's that externalizing blame piece. It is minimizing, denying, and blaming others piece. And what the victim said is that is part and parcel of everything that you see on the wheel, including the emotional and psychological abuse. And so it has been removed as its own component. So with that as an overview, that's who is likely to be coming through your door at the FJC. You're going to have older domestic violence victims. You're going to have victims of abuse at the hands of adult children, where the tactics that you see on the current slide are playing out in that elder's life. Dean, why don't you talk a little bit more about how the FJC might work with older clients?
So, Natalia, on the next slide, there's a wide continuum of abilities, and assuming that just because someone is older that they are cognitively impaired is not fair. Age is not the same thing as dementia, and there are lots and lots of different considerations that providers of community services need to be aware of when working with older clients. Go ahead to the next, Natalia. Aging is associated with common deteriorations in certain physical processes. Vision and hearing commonly need to be accommodated when we provide services. Consider medications. Most people, as we get older, end up on more and more medications. If there are medications prescribed that are abusable drugs, very often abusable drugs are being used as a point of manipulation by younger caregivers. Family members and caregivers may divert those drugs for self-use, and they may withhold drugs as a way to coerce an elder into other aspects of financial exploitation or simply to torment them. Drugs can also be used as sort of a chemical straitjacket. They may improve drowsiness, sleep, mental clarity, and just stop the elder from complaining in general, and those drugs can be misused deliberately in order to provide unnecessary sedation. The drugs may be associated with increasing risks of physical injuries when elders who are over-medicated are trying to ambulate on their own. And the medications can either mimic abuse or mask abuse, depending on how the medications are being combined or misused. Next. Many of us bring to the table beliefs of ageism, that all people who are older are necessarily therefore demented, unreliable. They can't give accurate renditions or testify. They may not be competent to testify. It is something to be aware of when working with older clients, that simply progressing slower, speaking slower, asking questions that aren't complex, trying not to be a lawyer, and doing a cross-examination when working with clients is very helpful. Next slide. We've already covered the continuum of abilities, and I want to summarize by saying that there are many forms of elder abuse that are commonly co-occurring. For example, some folks in the elder abuse services world say financial exploitation is always present, and it's the underpinning of many other forms of abuse. And I don't know if I would say always, but financial exploitation is so common as a component of elder abuse that it should be expected. Domestic violence and abuse in late life, it occurs all across the lifespan. It can be the consequence of lifelong domestic violence. It can occur from new relationships, and it can be intergenerational, so that other family members are filling in for an abusive partner who has left the home or has died. There are many aspects of domestic violence, sexual assault, financial exploitation, and physical abuse that competent providers at a family justice center would have to understand as a poly-victimization image, so that we don't overlook things like sexual abuse that are so frequently overlooked or underreported, but may be for the victim the most severe part of what's happening. At this point, we'd like to turn it open to questions, Natalia, and if you could fill Candace and I in on questions that might have come up before we move forward with the issues about confidentiality and reporting.
Thank you, Dean. This is Gail, and I appreciate everything that you've covered so far. I have to admit that when Candace talked about the new age of 50, I almost had an out-of-body experience, but I appreciate the fact how both of you have acknowledged age does not mean dementia, and how older adults are still functioning very well. And I particularly liked your comment about just because they may be slower in processing the question and answer doesn't mean that they're not credible and important witnesses in your case. So I'm definitely reflecting on our work here as well at the San Diego Family Justice Center and how it was incorporated here locally with the leadership of Paul Greenwood. We do have some questions that are coming in for the first part of this training. The first one, I'm going to go ahead and give it to Candace because they're specifically asking for Candace. Candace, if you are not going to address the issues later, please discuss briefly the concept of undue influence and how that is tied to the power and control dynamic.
Oh, there's an easy one. I think that's the second hour and a half of this webinar. Undue influence for those, I'm going to try to make this really short. It's an incredibly complicated question, and to whomever sent it, eventually if you want to have an offline conversation about this, we may want to do that, and I'm open to it. Undue influence is a concept that people who appear to consent to certain acts are really doing so because they have been misled, they have been misinformed, they have been lied to, they've been denied information. And it is the substitution of the will of the perpetrator for that of the victim. It's very secret, and many victims don't even realize it's happening to them. The wheel that you saw earlier for domestic violence and abuse in later life is a starting point for thinking about elder abuse. Undue influence can affect why victims don't report. It can affect why people remain in relationships. It can explain or help us understand why people appear to make certain kinds of decisions. When we look at different theories around undue influence, one of the things that we came to see is that there are many similarities between undue influence and abuse in later life, including that the use of a wheel of co-occurring tactics that are for a particular purpose do occur. For those who would like to take a look at work that's been done using the wheel on undue influence, I would direct you to the National Clearinghouse on Abuse in Later Life. That's www.NORACALL.us, and do a search for the term undue influence. You will go to a curriculum that lays a lot of this out and also provides a wheel that helps explain what the tactics commonly seen in undue influence cases. That's a really convoluted answer, but it's a really complicated but important question.
Thank you, Candace. And before I ask two more questions that we have for both of you, I think it might be important for me to just give a little framework about family justice centers for those of you who may not be at a family justice center and you're on this call because you want to learn more about elder abuse. So at a family justice center, as many of you do know, it's a co-location of many different professionals working in one location to provide as many services to a victim as we possibly can. Many family justice centers will open up with a wide scope of dealing with domestic violence, sexual assault, child abuse, elder abuse, and some are now handling human trafficking. Other family justice centers may dream big but start small, specifically dealing with just domestic violence. The challenge is that once you open up your doors to provide services to victims of domestic violence, we found early on at the San Diego Family Justice Center, others will come. So quickly we realized we were handling and dealing with elder domestic violence victims and how you go about dealing with that. And each center has expanded those services to bring more partners on site. And that was one of the main reasons we wanted to have Dean and Candy share all of their experience as we move forward. So now I want to ask you some of the questions that have come up. We have two in particular. The first one is, how do you address complying with mandatory elder abuse reporting laws and working with domestic violence victims that come to your agency for help, such as a family justice center or even any other agency?
If you'll let us turn to the next section, someone has anticipated the next part of our presentation.
Okay, we will hold that, then we'll go to the next one. If you are an older client being abused by your husband, should we follow the domestic violence protocol or contact APS and follow the APS protocol?
Could I just ask that we hold that question till we finish the next section? And I'd ask Gail, bring that question back up either at the very end or at the end of the next section. The next two sections are going to touch on different aspects of those questions.
Okay, I think what we realized is that people want it all. They want to hear everything you have to say, so what we're going to do is keep moving forward and save all the questions until the end.
Okay, thanks. And we're eager to jump in and talk about the law. Dean has decided that I have to talk about the law because I have initials after my name that are different from his. And he did confess that he really didn't want to try to justify the law. So it's me. Good luck, everybody. So please move to the next slide. We are talking about reporting laws. Every state with one exception, and even that is subject to disagreement, but every state except New York, and some in New York say they do have mandatory reporting, has some mandatory reporting related to elder, or what is sometimes not called elder, but vulnerable adult abuse. We cannot possibly tell you every statute in every state in this conversation. And so there is a homework assignment, and that is that everybody with this overview needs to go home, look up your statute, and it's going to provide some of the answers for how does this apply to you. There is tremendous variation in reporting requirements. As examples, some states require every person to make a report when they suspect abuse. Other states only require certain kinds of specified professionals. Usually healthcare, law enforcement, and others are commonly listed to make such mandatory reports. Next slide. In terms of what, who is subject to the report, whose behavior needs to give rise to a report, some states have an age-based definition. Here in California, if you suspect abuse of a person over 65, you are a mandated reporter by profession, you have to report. So we use an age-based definition. Other states feel that approach is ageist or have other objections to it, and other states, as a result, use a vulnerability statute. So you must have someone who is at least 18 who has some sort of significant disability that prevents them from protecting themselves or their legal rights. Some states combine both age, starting at 60 or 65, plus vulnerability. Some states only require a mandated reporter to report if the elder is unable to report for themselves. So one question you need to ask yourself is who is the victim that gives rise to a report? Another variation, keep moving please, is what do you report? What kind of conduct are we talking about? So again, wide variation. Some states, well, virtually every state includes physical abuse, but physical abuse can be defined in a variety of ways. So in some states, physical abuse includes sexual abuse. It may include things like confining or falsely imprisoning. In some states, it also includes domestic violence. Many states include neglect. All of the others, it is a wide variety of what has to be reported and by whom. Next slide. Who has to cross-report varies as well. So it's common that if law enforcement receives a report about an elder, they need to cross-report to APS. Many states require APS or similar, APS, Adult Protective Services, or a similar entity to cross-report to law enforcement, but that duty arises only when there's a suspicion of some sort of criminal conduct. Most states require the report be made to APS. Some states say APS or law enforcement. One or two states provide reporting of certain crimes to the prosecutor's office. And how soon people have to report varies widely. Dean, you're going to talk a little bit about issues related to long-term care.
Healthcare reporting, which is, at least where I am in Indiana, the majority of reporting of all the calls to Adult Protective Services for elder abuse and neglect, 80% come from the healthcare setting. Mandatory medical reporting for elder abuse and neglect changed dramatically in 2010 with the implementation of the Affordable Care Act. Among many of the benefits of the Affordable Care Act, there is an enrollment which has staged in over the last 5 years for the Elder Justice Act, which was wholly incorporated and almost randomly and beautifully mixed in with the Affordable Care Act. Of all those things that the Elder Justice Act mandated of health care, it completely changed the spectrum of who is required to report elder abuse and neglect in a healthcare setting. When the Affordable Care Act was implemented, they created some new vocabulary regarding the way that elders live in our communities. The terms long-term care, skilled nursing, assisted living, those words are used differently in laws in different states. What is necessary to be an assisted living facility in California is different from what could be embraced as a licensed assisted living facility in Indiana. Knowing what your local standards are helps, but the Affordable Care Act helped more because what it did was standardized mandatory reporting across all avenues of elder housing facilities. If a facility receives more than an aggregate of $10,000 a year from federal resources for elder residents, and that includes veteran living benefits, Social Security, and Medicare disability resources. And I would argue that practically every apartment complex for senior living in the United States receives more than $10,000 a year in such funds. That facility is now listed as an LTC, or long-term or licensed care facility. That facility is required then to provide mandatory reporting of elder abuse and elder neglect, and that mandatory reporting is extended to the owner, the manager or operator, any employee working in the facility, whether he mows the grass or cooks in the kitchen or provides assistance with activities of daily living for residents in their rooms, and it extends to any contractor who's in and out of the door, like Meals on Wheels and home health care workers and people who come to change light bulbs in the facility. All those folks are now enrolled as mandatory reporters, and they must report suspicion of elder abuse or neglect. That's changed considerably the number of elders living in the United States who are now afforded the protection of being in a place where mandatory reporting is necessary. So Candace, you want to pick up with voluntary reporting?
Yeah, I'm going to make one more comment about the changes for reporting. One of the big problem areas about detecting elder abuse in long-term care had been that the boots on the ground in most facilities were the long-term care ombudsman, and they operate under federal rules that permit them to report only with client consent, or if they walk in and see the abuse actually occurring. Because many of their clients are not able to provide consent to report, there was a big hole and lots of problems going on in facilities were undetected. And so one of the reasons for the change in the federal rule was to increase the reporting of incidents occurring in long-term care. I want to talk now about voluntary reporting. Anybody can decide that they wish to report suspected elder abuse, and it can be done anonymously. Mandatory reporting, of course, you have to provide identity, although your identity is subject to non-disclosure. It is confidential. That said, it can be discovered in the criminal justice process, through a court order, and so on. So many people would rather anonymously report. There isn't a single 1-800 national number to report. However, there are state-specific phone numbers for making reports. And the website that is on the screen is one of several places where you can locate the numbers applicable to your jurisdiction. I want to talk just a moment now, and this is starting to circle to the questions that we left hanging at the end of the last session. So what is the connection between domestic violence confidential advocates and elder abuse? And the reality is, most of the time, if you're dealing with a younger victim of domestic violence and you're a community-based advocate, you enjoy a confidential relationship with your client. And what comes with that is that you are not required to report domestic violence, even if others in your state are. That is not the case once that client, who is a victim of domestic violence, ages into meeting a legal definition of elder abuse or meets a statutory definition of a vulnerable adult. And remember, that could be a person 18 and older, but who has a significant disability, limiting their ability to meet their needs and protect themselves. Unless there is an exception in your state, mandatory reporting laws for elder abuse and vulnerable adult abuse are going to apply, notwithstanding your legal status as a confidential DV advocate. Let's go on, and I'm going to expand on that just a little bit. And I want to talk about what is the standard when you have a duty to report. And now I'm talking to those of you who might be confidential advocates, absent an exception for elder or vulnerable adult abuse law, absent an exception in your state. You have a duty to report elder abuse or vulnerable adult abuse when you have a suspicion. that does not mean absolute proof. You will not be well served, and you do not have a legal defense for failing to report when the law said you had to do so, simply because you haven't completed a comprehensive investigation, or even if as a result of an investigation it is not substantiated, meaning it didn't meet that level of proof that a state requires to substantiate an APS allegation, which could be preponderance or probable cause. In some states, it's clear and convincing evidence. And of course, if it's a criminal investigation, it's guilt beyond a reasonable doubt. Lest you think that this is the only place where you might have the conflict between DV, duties to report, and confidentiality. In a few states, you already have a duty to report, even if you are a confidential advocate. You certainly, in most states, have a duty to report as a confidential advocate when you learn about child abuse, and you have a duty to report when you're in a so-called terror-self situation. These are so-called duty to warn or duty to protect from an identified person posing a risk to another identifiable victim, posing a risk of serious injury or death. So some of you, next slide please. Next slide. Some of you receive funding through the Violence Against Women Act, and I just want to make a point. As a grantee or sub-grantee under VAWA 2013, you are not violating confidentiality requirements under VAWA when you report elder or vulnerable adult abuse, when you are required to do so by state or tribal law. And the code section in the VAWA is on the screen in case you need the citation. So this brings us really to a discussion about some of the challenges and some of both where the conflicts may arise between ethics and law. And these are really intended to get you thinking, if you're in an FJC that is contemplating serving older adults, and for those of you from FJCs, my hope is that it is all of you if you're not already doing that. We are living in a tsunami of changing demographics where the greatest change in percentages of our population are not in the younger, but are in those 60 and 65 and older. And that trend is going to continue well past 2050. You are necessarily going to be seeing more and more older adults who are victims of abuse. And so this is a time for you to develop and test policies and procedures that you either already have or should create when you're thinking about serving older adults and your potential duties to report elder or vulnerable adult abuse. Policies and practices should include how do you work with clients and respectfully educate them about your legal reporting requirements. I suspect most of you do that regarding child abuse. You have a way of talking to clients before you go into their stories and go into their needs, where you let them know about your legal reporting requirements. You need to have a similar and thoughtful discussion about how you do that with clients. You need to know within your FJC who has the duty to report and how is that duty going to be discharged. It also carries over thinking about who's in your FJC and who might be doing certain elements of work in your FJC. So does it cause you to rethink or want to reconsider some of the partners? I want to suggest to you there are ways, thoughtful ways, to be able to serve older adults without violating the law. But you need to be thinking now about what those are. There are, without a doubt, potential challenges that advocates and other agency members may have, and their principles and operating procedures, such as empowerment, self-determination, autonomy. You will find that many of you share these kinds of goals, but they now need to be done if you're serving older adults and and vulnerable adults. They have to be done in a way that still meets your legal requirements. Moving along. Here are some of the questions that I urge you to note and take back to your FJC. So if you do case reviews, and this is commonly done in elder abuse cases, many communities have adult protective services multidisciplinary teams that do case review. It may change, or it may at least affect how you deal with who is part of your case review team. You may want to look at your statutes to see if case review teams are accepted from mandatory reporting. There may be special rules around multidisciplinary teams that indicate that what is done within the team may remain confidential and separate from individual mandates to report. You also need to think about how is reporting going to affect your relationship with clients. And I would urge that you draw from your experience working with child abuse in deciding how do you go about dealing with clients. You need to think about ethical communications, and if you report, above all and uniquely, those of you at FJCs, you need to think carefully about how do we address client safety in an environment of mandatory reporting. I want to say one other thing. APS serves many wonderful purposes, and they do things they call safety planning. It doesn't mean necessarily what DV means by safety planning. It may address things like environmental hazards and getting medications and making sure that a victim, an elder, can safely move through the house, that it's not filled with trash or there's no safe escape. In DV, the term safety plan has much different meaning. The beauty of an FJC is you can harness both definitions and better serve the client's overall needs around safety. But when you're thinking about mandatory reporting, you really need to make sure that older clients' safety is addressed using not only the APS but the DV lens that you uniquely have. So summarizing this section, the points that I want you to take away are, next slide please, are you just have to know, and your staff has to know, what are your laws in your state regarding elder and vulnerable adult abuse reporting. You need to be clear on what must be reported, when reporting is required, and when you can voluntarily report. And of course you need to have policies about voluntary reporting. How are you going to meet reporting requirements? And then you need to develop that ethical framework for accomplishing reporting requirements while serving clients and assuring and enhancing victim safety. On that note, I think we're going to hold the questions. I think I heard Gail say that, and move to the final section, and then we'll talk about all of the remaining questions and see if we've addressed them in the last two sections. So this really is drilling down a little bit on some of the themes that we laid down earlier, responding to elder abuse and serving older clients. And really the overarching questions is, how does an FJC serve elder victims? And how does an FJC effectively participate in a coordinated community response, or CCR, that addresses the needs of older victims. I want to suggest a framework, and there are going to be six clicks right now, Natalia or Gail, please, to fill this out. What I want to suggest to you is if you're dealing with older victims who recognize that they need assistance, they may turn to any number of places. And the different bubbles that you see on this screen are just some of the places that they may turn. This is a slide that we took from the National Center on Elder Abuse, as mentioned at the beginning, so we didn't have the freedom to change this slide, but I could see an FJC looking at where are all the places elder victims might connect, and the FJC would be an additional bubble where a victim could call. The problem is, and let's go to the next slide, is depending on where that victim turns, a community needs to develop a system that's based on the assumption that it really doesn't matter. And the FJC needs to be part of it just doesn't matter which door a victim knocks on. Whether a victim turns to informal relationships and networks, turns to more organized investigations through APS or law enforcement or prosecution, or turns to the FJC for services and advocacy. The key is these entities have to be talking together, they have to be coordinating, and they have to make sure that, and now let's go to the last of these visuals, the next slide please. We have to make sure that the doors are open, and it really isn't up to the victim to figure out what's the right door. The door doesn't matter. All doors are open and none are closed. Now, in a sense, that's what an FJC does by co-locating services and making it easier for victims to get all of the services they need. This model has proven to be effective, and it has proven to be beneficial where services are at one location and the victim gets what they need, no matter whether it's informal, advocacy, or investigations. They're all at one place. What I'd like you to think about is how do older victims get the benefit of the FJC model of service provision and no wrong doors. If your community hasn't already started reaching out to older victims, this is a real opportunity. And as you've already seen, it's not without its legal and ethical conundrums like reporting, but like you have already done with other kinds of abuse, you know how to do this. It's just a little different discussion. So I want to suggest some easy fixes, if you will, for how you might help reach and meet and find elder abuse victims so that your door truly is open. Think about screening, and now we'll go to the next slide. You already talked to younger clients. Could you, as part of your screening, inquire if there are others in the home, such as an elder or a vulnerable adult, and ask, is that person safe, or is stuff happening, is bad stuff happening, are there services that person needs to be safe? Experience has taught is when there's an abusive party in the home, they will attack all vulnerable people in the home, whether that is a spouse, some of the children, and certainly the older adult who might be your victim's mother or grandmother. If you're screening older clients, don't forget to ask, are there younger adults in the home who are also being harmed? If a person is being offered services, but they're saying, no, 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 can't do that, or that all sounds good, but no, that's not for me. Explore why that is. I'm going to share an experience that Dean had. I've heard of it in other connections as well. But Dean had a patient at the medical center who was a younger victim of domestic violence who desperately needed services for their own safety as well as their children. But the person kept declining services and ultimately finally disclosed that the reason they couldn't accept things is because the victim's mother, who was elderly, was also in the home. And the perpetrator had let that victim know, if you ever tell, if you ever reach out, if anyone finds out what's happening, it won't go well for your mother. Well, we have to know that. And you are in an ideal location to identify, just as Dean's clinic did, situations where it just isn't safe for somebody else to accept services. Some communities have FJCs with elder abuse specific advocates and navigators on staff at the FJC. And the beauty of that is, once an older person is identified, they are referred directly to that staff member, who then starts talking to them about elder-specific services. And if there's anyone here from Sonoma County FJC, they would be a good place to turn if you're trying to think about how might a different community start to think about a position like that. Let's talk about older victims and what might be different beyond screening to find them. So let's talk about serving older victims. And now what I would like you to think about is, how do you connect as an FJC with the public, and in particular with older victims? And ask yourself, pull all of your materials off of the holders they're now in. Is what you're describing going to resonate with older clients? Are they going to identify with your materials? Are they going to see faces of people who look like them, whether those are culturally specific, male and female, same-sex relationships, and are there older adults? Are there men as women, as well as women? In elder abuse, we have many more male victims than we traditionally see in domestic violence. Think about things like font and color contrast. Dean mentioned that in later life there are natural occurring changes to vision. My glasses have gotten thicker and thicker, and I've moved to 3 levels of progressive lenses as I have gotten older. There are things I can no longer read comfortably, and I don't think I'm the only person on this webinar who has a similar experience. Think about, can people understand, can they see, can they read the important materials you've developed? Think about people with vision problems and hearing issues. Do you need materials in other formats, including computer-assisted, things that can be delivered on a DVD or through listening, and so on? And then think about your staff, both paid and volunteer. Do you have older victims or older faces for older victims to recognize and feel comfortable with? Do you have men and women? I will tell you that while older victims in general are very gracious, or will try to be, and for many victims, criminal justice agencies and folks like FJC professionals are still seen as wearing the white hats. The reality is, if everyone they see is younger than the clothes they have hanging in the closet, they're going to have trouble trusting you and believing you're familiar with their life experience. Let's move along. In terms of services, the services that you see listed on here, and I'm going to move fairly quickly along in the interest of getting to your questions. Older victims need different housing options than younger victims. They need some of the same, but they need other. In terms of programming, they do benefit from support groups, but I'm not sure that a support group with 20 and 25 and 30-year-old victims with young children are necessarily going to be effective. There also are different challenges with getting older victims to see the value, initially at least, of joining support groups. And once again, don't forget about older male victims. It may be critically important for you to partner with Adult Protective Services. So a quick word about APS for those who haven't worked with them. Next slide, please. There's a lot of misinformation about APS, that the societal belief is they're there to take people out of their homes and lock them up in nursing homes, and that they are essentially CPS for grown-ups. Both of those are myths. The primary goal of APS is to maintain the health and safety of clients in the community, in their homes, if that is possible. Additionally, they are voluntary service. They cannot require anyone to accept their services or even to accept their investigation in some cases. They cannot forcibly remove an elder or subject an elder to a mental health review. Next slide, please. And their role is social services. It is not to enforce the criminal law. Why is that important? If people do not meet their eligibility criteria, please understand they are responsible for closing cases. Many don't know FJCs and don't have a process to hand off or refer closed cases to you where you might well be able to provide services. So next slide, if you would please. Let's next slide, please. I'm going to jump over a couple of slides. I'm going to leave it to you to pull these down if you need them or want them, but what we're going to talk about in the next two slides, next slide please, is what are some of the challenges, and I think we've highlighted a lot of them already. They have a different focus, they have a different training, and they operate in many cases without a domestic violence framework, and they may accept behavior in a way that we would not using a domestic violence framework. Next one. But there are also benefits of involving them, and I think once again we've highlighted many of these. So we're going to close out our discussion by turning mostly to Dean, talking about your role as part of a CCR for elder abuse.
So I do work with an elder protection medical clinic that is part of our local community response elder abuse coordination. And the role of the clinic is to both refer back to the service center for client services and to provide the service center with a healthcare referral center so that we can help them with documentation of evidence and of overall healthcare needs for elder clients who show up first at the Family Justice Center. The idea behind building this coordinated community response is that we work together. On the healthcare side, we provide things that are resources that the center finds helpful. One of the things we provide is a navigator for getting their clients healthcare insurance. Another thing that we provide is expert witness service for healthcare needs for people who have injuries. What they provide for us is a client referral center that helps us with keeping people out of the hospital. The frequent flyers in the healthcare geriatric medicine population are very commonly elders who are being neglected or abused at home. And if there is elder abuse and neglect in the family dynamic, then those people are not going to stay out of the hospital. And so it's a twofold service here for working together. Why don't you go to the next slide, Natalia, and we'll talk about specifically co-located resources. It is very helpful for me with co-located resources to have constant training and reminder to our healthcare staff that it's their duty to be screening for things like domestic violence, sexual assault, and stalking in these homes. And the healthcare staff then becomes a secondary site for confidential reporting by patients in our service, who we can then send back to the appropriate advocacy for follow-up. As far as a handoff of services for elder or vulnerable adults who don't meet APS eligibility guidelines, having APS work out of the Family Justice Center is a mechanism to ensure that the client isn't just falling through the cracks, where their particular problem isn't addressed by one agency or the other, but instead there's a discussion about what the best resources would be for each and every client. And then to come up with relevant safety plans so that their residential need as well as their criminal justice and advocacy needs are all being met together. And then, Natalia, if you want to take us to the elder abuse responses, we want to incorporate everything that we know about domestic violence into our community responses with elder abuse because they're so closely related. Where you have domestic violence in later life, you're going to have elder abuse and neglect, financial exploitation, and probably sexual abuse. And all of those things, cross-training is necessary for all of these areas. It's a multidisciplinary approach. It's always a team sport. There's no one site or one provider who can take care of all these needs. Next slide. It's a whole jigsaw puzzle. There are faith-based services, family justice advocacy services, police response, adult protective services, healthcare services, families and courts and educators and policymakers throughout the community, all of whom have just a part of a larger picture of a multidisciplinary response for elder abuse and neglect. Candace, you want to talk a little about communities that have actually developed these working coordinated elder abuse teams?
And there are many. Let's go to the next slide. And just very quickly, these coordinated responses have taken a variety of forms in elder abuse. This is really just to get you thinking about how big the response to elder abuse can be and what the different teams might look like. And so all of these are different kinds of coordinated responses that communities have developed, either to work cases or to look at systems. Let's keep moving. We're going to summarize this section, and I'm going to just tell you, as you can read through this, that there are some resources for elder abuse that are on the remaining slides should you decide to pull them down and make copies. I want to leave, I know we're desperately short of time, but I want to leave time for at least a couple of questions. So I'm going to end on this summary slide, and Natalia, if you want to just jump over those resource slides and take us to questions, that would be fine. Next one, please.
Okay. Hi, Candace. Candace, we are now at 11:28. This is what we're going to do to make sure that we stay within our 90 minutes, because we do have some closing slides. Natalia and I will look through some of the questions. We looked through some of the questions already, and it seems like you have answered most of them. I'm going to encourage anybody that has a burning question that needs to be answered today. You will see the email addresses for Dr. Dean Hawley and Candace Heisler. You can reach out to them directly. They've been kind enough to encourage you to do that and share their email addresses with you. This webinar has been amazing. It's very thoughtful, very thorough. I believe you've covered just about everything. For those of you who have questions about family justice centers, because some questions did come through wanting to know what is an FJC, and FJC is definitely a family justice center. We have a website at familyjusticecenter.com. In this PowerPoint, you've seen some amazing resources and links to additional websites to get more information. When you get an email from Natalia, that's when is your clue and cue to download this particular webinar. It's usually done within 48 hours or less, but the email is really the best notice. I did want to give a shout out to the California District Attorneys Association. They have an annual conference. This year it's going to be in Anaheim, California. It's that first week in December, and Erin Martinelli is the coordinator. So please search that. We will also post that most recently in our next Constant Contact. Again, if you haven't gotten a copy of Casey's book on Cheering for the Children, I think anybody that is working with victims of domestic violence, elder abuse, child abuse, or sexual assault in general needs to read this book about the ACEs study. We are excited that you are all part of this call. We got an amazing response given how many people are on this webinar. We want to thank Dean and Candace for sharing their amazing experience, their passion and their commitment for this subject. I am constantly amazed at how much I continue to learn from both of you. Thank you for sharing your time with us. And Natalia, thank you for putting it all together. I think we're at our end, and just say thank you very much. Join us again in our next webinar. This is Gail Strack, kind of reporting live here from San Diego, California. Thank you all for joining us. Bye-bye.